I am Vinnie Tortorich, folks. Your good intentions have been stolen, but don't worry. I'm here to help you get them back. You may be soft and succulent at the beginning of this process, but hang in there. Before long, you will be lean and mean, just like my guest today. It's the Friday show. You know what that means. We bring in someone with way more information than me, but that's not hard to do. I can just walk down the street and find anyone with more information than me. I'm talking about the beautiful Dr. Amy Gutman. Yeah. Oh, they love you already, Amy.
Crowd goes wild.
Amy, okay. Today, I've been waiting to talk to you all day long, and I'm not making that up.
Awesome.
And I'm going to tell you why.
Likewise.
I got to tell you a long story, but I'll try to make it short.
Please.
I've been doing stuff my whole life that's detrimental to my body. Mm-hmm. No, I've never done the cocaine. I've never taken illicit drugs. I've never even smoked. I've never had a joint. Can you believe that? Not one joint. Not one joint. I had one cigarette when I was like, I don't know, 12 or 13. It wasn't even a cigarette. I took a puff off of my buddy's cigarette. Mm-hmm. And I went, yeah, no, this tastes too much like I just inhaled a campfire. And I knew from that point, when I'm at a campfire, if the smoke is coming in your direction, you walk to the other side.
Exactly.
Why would I purposely walk around putting a campfire in my lungs?
Exactly.
Look, I'm that kind of dumb. I just go, this doesn't make sense. I'm going to do something else. So I've never done drugs, but I'm beat up to death. Football all the way through college. Mm-hmm. Right. That's enough right there. The fact that I don't have CTE is a miracle. I have fake joints, from football and the whole thing. Rock climbed. I climbed for almost 20 years. You know how many times you fall? And I just have my hands zapped because I have, what do they call that? Dupuytren's contracture.
Yeah.
I never thought I'd have cancer twice, right? I've had,
I know.
You name it. I've beat powerlifting. I'm not talking about the good kind of weightlifting where you could keep nice muscle in your body. When I was playing football, we were all, the term clean and jerk, that's the name of one of the
I know.
It's got jerk in the name.
Right.
Right. You're jerking a lot of weight from the floor up to your clavicles. That alone, right? I bet you didn't know this. I'm going to brag a little bit. I had a professional mountain bike contract for a while.
I did not know that.
Not riding in the regular NORBA rate. They were called NORBA back then, North America. Mm-hmm. No, I was in solo ultra events as a pro. 12 and 24-hour races on a mountain bike. Now, you know what it feels like to ride a mountain bike for 2 hours and you just want to sit down for the rest of the day because you've beaten the crap out of yourself?
I used to do triathlons, and that I know the tush, and the bits. The bits.
I mean, your arms, your neck, everything, back, everything. 24 hours. And I did that for years.
Yeah.
So I'm beat to crap. When they're not going to put me in a coffin. I'm going to give whatever I can to science, and then the rest they could just chuck in the ocean. And so that's where I'm heading. There won't be much left to me when I'm done. Right.
I have to tell you look pretty darn good for someone who's done that much damage. There must be something to this nutritional approach.
Yeah, I'm the opposite.
Like science.
Well, you know what they say about a vagina? It looks bad but feels good. I'm just the opposite of that. Mm-hmm. I'll look good but feel bad.
That seems to be. I would disagree with you because people who feel bad look bad. I would say maybe you're not quite as bad off as you say you are. You know as well as I do, there are a lot of really old 40-year-olds. There are a lot of really old 30-year-olds.
Right.
And there are a lot of really young 90-year-olds.
But if you saw me get out of this chair right now, you would go, ooh, that's ugly. Because
bad sounds.
I've been having this lower back thing for about 40 years.
Okay.
Played sports through it, everything. But about once every 4 or 5 years, it'll get me.
Mhm.
And it will get me in a way that I'm crippled, like
Mm.
I'm so I felt it come on today as we're recording this on Wednesday the 16th, about a week ago. Last Wednesday, I felt it coming on.
Mhm.
So whenever I feel it coming on, I take it easy.
Sure.
Even though I was taking it easy, it kept coming. And by Thursday, I was sitting, I got done with podcast and everything. It was about 8 o'clock at night. I figured I'd sit down and watch a little murder porn, some
Sure,
Dateline,
of course, absolutely.
as one does.
Of course, as one does.
It's always the husband or the wife. So if
Mhm.
the wife is dead, it was the husband. If the husband's dead, it's the
Absolutely.
wife. They don't even need to do a trial. They can
Yeah.
make it a 5-minute show. They could go, this woman died in a mysterious way. It was the
Mhm.
husband.
Yeah, move
And
on.
we can just move on. I'm
Yeah.
David Muir, and this is 2020. The wife is dead. It's the husband. Go to commercial and just start a new one, right?
Sure.
Okay.
Or the husband's girlfriend or the wife's new boyfriend. It's
Right. And the kids are
sometimes
always
mix it up.
standing by the living parent going,
Mhm.
he's all
Oh,
we have left.
yeah.
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 His fingerprints were around her neck. You want that hanging around? Come on.
Exactly.
Anyway,
Exactly.
I'm sitting around watching Dateline. That's
Mhm.
David Muir is 2020. Dateline's the other one. I got both of the murder porns going.
Yeah,
Yeah.
absolutely. Gotta.
So uh, I'm enjoying myself, watching other people's misery. And then it was time to get up and go to bed. And it was around 11:30, and I knew my
Mhm.
wife was sleeping.
Mhm.
And my house has 3 floors. I'm on the bottom floor.
Mm.
My bedroom happens to be 2 floors up.
Yikes.
I'm trying to get out of my chair, and I can't.
Oh my
I
gosh.
I considered sleeping in the chair. It's like, I just have to stay here. I'm not gonna wake up my wife. I can't get out of the chair. I don't know what to do. I had a cell phone right there. I could have called her and said, "I'm not gonna
Sure.
wake her up." The only reason I knew I had to get out of the chair was because I had to pee also. I know, look, you're an emergency room doctor.
Mhm.
So I went, okay, then you got to get out of this chair. You're going to be peeing in your favorite chair.
Yeah.
So I rolled onto the floor, as you can imagine, and the pain was excruciating. And
Interesting.
I stayed on the floor for about 15 minutes. And then I was able to crawl
Ugh.
to the exit of my office. My office is also where my favorite chair and my TV is.
Sure. Of course.
Yeah. And
Your man space.
yeah, it is. I got a gym in here and everything. I crawled past the rowing machine and the bike, right, right past the power rack that probably caused the problem. I
Probably.
crawled out the back door to take a leak from my hands and knees. I kid
Because
you
you
not.
I have not heard I mean, I hear that same thing almost every night from people who abuse their bodies in sort of different ways. So I think I'm, again, the world's angriest trainer. I'm not the one to tell you that
Right.
there are good ways to abuse your bodies and bad ways to abuse your bodies. You don't go through a lifetime of either professional, semi-professional, or even just for enjoyment sports without hurting something. It's repetitive injury in one way or another.
Right.
The question I have is, so when you have these bouts, so there's a very big difference in back pain in the ow, my back hurts, and I don't have any. I mean, I certainly don't mean to get into your personal health, but
No, go
like
on.
there's back pain with neurologic functional problems, and there's back pain that ow, I hurt. So one of the big things that we talk about with back pain is back pain plus. We call it the red flags of back pain.
If
Are
you're
you a
talking about the Dr. Sarno stuff,
There's some Dr. Sarno stuff, but when we look at it sort of physiologically, so are you a male with a history of prostate issue? Are you have any cancer anyway? Do you have any fever? Do you have neurologic abnormalities, or do you have what we call instrumentation? So if you have those things, it raises our interest in back pain. And the big neurologic things we worry about with someone who has back pain or even maybe doesn't have a history is one of the crazy questions we ask patients are, can you feel your groin? Actually, this is the way we phrase it, because
Okay,
I'm a very blunt person, is,
let me
can you
go
feel
deeper
your
because
penis? Can you
I was
feel your penis?
all right. So yeah, I could. Um,
Good job.
um, all right. So all right, I'm gonna because I want to get into a different story, but now we're on this story, so this might
Sure.
help someone. So let's do
Sure.
it.
Of course.
So after I took a leak, one problem averted,
Yes.
and then I crawled back into my office and
Okay.
closed the door,
Okay.
and I said, "Okay, now I have to get up.
Okay.
I have to get on my feet."
Mm.
And I took my time and slowly, it was so sharp. A few times as I was getting to my feet, it buckled me back down to the floor.
Mm.
And so finally, I'm using my spinner to hoist myself up, and I finally stand up straight. And once I was able to get it to buy into the fact that I'm now erect, as you know, like as a human,
Upright.
I I slowly start using the spinner and then the bike next to it as a crutch, and then the chair next to that as a crutch. I make it to the stairs, and I looked at those stairs as if I was at Hillary's step. And I said,
Exactly.
okay, I got to get up those stairs. I got to get up the first flight of stairs and at least make it to the ground level because Serena's going to wake up during the night. And if I'm not in bed, she's going to get scared.
Sure.
So if she starts yelling, honey, where are you? At least I could be on the first level and she can hear me.
And you didn't think even at this point to pick up the phone and go, maybe I should get her involved early. I know the biggest, so there's two types of
She's
male
a
patients,
small
if I
woman.
may.
Now go on.
There is the I have a hangnail and dear God, I think I'm dying. Or the I've been stabbed in the chest 17 times and no, I need a band-aid, but I'm going to work. I would assume you're the second type
All right,
of
let
this.
me explain to you who I am. My mother, my dear old mother, who's still around,
Italian.
she was coming back. My dad always played music as a second job. They were coming back from a music gig one night
Mhm.
and around 1975, 76. And they hit a cow and
Oy.
totaled the car. And my mom, her knee went into the dashboard. This is back when dashboards were not
Oh,
as
yeah.
living as they are now.
Yeah.
She walked around and complained about leg pain for about a week,
Mhm.
maybe 2 weeks, because
Mhm.
she buckled a couple of times and she went in. It was completely broken. My mom walked on a broken leg for 2 weeks.
I have
And
no
then
doubt. You come from tough stuff, clearly.
no, we don't feel pain the way normal people do. I have the same thing my mom has. Dr. Hirsch, our family doctor and close friend,
Mhm.
when you play college football, when you play D1 ball, you're a commodity.
Sure.
So the school athletic doctor, they talk, the team doctors talk to your doctor. They want to know what they're getting. And I didn't know this, but in my report, Dr. Hirsch said, if he flinches, pull him off of the field because he's probably broken something and he won't tell you. That's the kind of pain I can endure. When I went through leukemia, I've had
Mhm.
now 4 bone marrow biopsies,
Mm.
cold, no nothing,
Some
no
of the
nothing.
most painful it's like literally one of the most painful procedures that you can have.
I've had 4 of them, maybe 5, no, nothing. I just tell them, go in. When I was doing it with my last bout of cancer, this doctor was going, I could, the nurse was like, you're not feeling anything? It's like, no, you just, I could just
Ugh.
relax into pain. That's the kind of pain I can take.
But this is different. Yeah.
This is bringing me, because when it's just normal hurt, I can take it.
Sure.
This was crippling me. That's how bad. This is worse than any bone I've ever broken.
And yet you had this magical device next to you
It
that
was
you could have
actually in my back.
used.
I put it in my back pocket. So, it was my last ditch effort. Right. But when we woke up the next morning and I was in bed fully clothed
You
with my
got
shoes on,
upstairs.
I
Wow.
made it up that second flight of stairs, is what I'm trying to tell you.
Wow.
Okay.
So
So,
so it's an interesting question about, so it talks about pain because, I talked about that in my TED Talk, that pain perception.
right.
So pain is very subjective. Your 10 out of 10 pain is very different than a lot of people's 10 out of 10 pain. Everyone's pain is different. I do find that the older Italian females or females of a particular age, I can have like 6 rib fractures. Like, I'm fine, move on.
Yeah.
And I will not make generalities, but younger generation has a very different perception of it. I would assume, based upon what you've just told me, that when you say, I did not think I was going to make it up the stairs because the pain was so bad, it was probably here kind of pain.
It was 10-ish. And
Yeah,
look, my 5 is most people's 10. I'm just going to tell
sure.
you what.
Of
That's
course.
why when I got to college and I would, I would, go, and they would pull me off to the side. It's like, what are you guys doing? Every time I flint, and it's like, it's in your report. Right. And they did. And by the way, one time they x-rayed my hands and like everything has been broken 10
Yeah.
times. Everything in my body has been broken. So this is bad. I can walk
Mhm.
around with broken bones and I have done. So I make it up to bed. I'm still dressed the next morning. And my wife
Shoes
goes,
on.
shoes on. I said, don't worry, hon. I didn't brush my teeth either. So no kissing. So it was bad. And she goes, oh my God, So I took a 600 mig ibuprofen,
Mhm.
and that didn't really. It touched it a little bit, but it
Mhm.
didn't really touch it. And of course, I had to get out of bed because I had a whole day of podcasting and everything.
Sure.
Right. And then the next night, I'm sitting in my chair again. I made it to my chair. Same thing. I was like, oh,
Did it
here we
occur to
go.
you at any point to maybe get some sort of medical professional involved?
Well, we're good friends with my doctor, my the MD you go to that sends you to the other MD.
Yeah, the primary care doc.
Yeah, that
Yes.
one. So we're good friends, and Serena goes, I told Debbie about, and I was like, oh, geez. All right. So then Friday night, so then, Debbie calls me and she goes, are you okay? And I'm like, yeah, I'm fine. I said, Deb, can you do me a favor and hook me up with some Flexeril? That's what
Yeah,
they used to give us back in the day. I said, just give me
sure.
some Flexeril. I got to get the spasm out and I'll be fine. So she got me some Flexeril. She asked me if I wanted anything else, and I'm not good with any kind of narcotics. They just
Sure.
don't. I know some people like the feeling. I'm one of those people that feel weird and nauseous and everything else, but I know I can take Flexeril.
Sure.
I take a Flexeril, and now I'm woozy, and the
Mhm.
pain is still it.
Yep.
So Debbie calls me that night. She goes, "Did it help?" I said, "Debbie, I had all of the side effects of the Flexeril.
Mm,
I took a nap and everything else.
no benefits.
No, but she goes, okay, so it's nerve. She goes, it's nerve.
Sure.
I should have given you gabapentin. And I went, stop
Mhm.
with the drugs. I'm not taking a
Yeah,
gabapentin.
right.
Right. So w- I got a little better on Saturday.
Mhm.
So we're out to dinner with Debbie and her husband, who's
Oh,
also
okay.
in. So I'm
Nice.
able to sit, but I look like shit. I mean, I'm
Mhm.
getting up, I look like a 90-year-old man. This is horrible. And so this week, Debbie goes, you got to go get MRI. We need to get an MRI and then I can
100%.
this is where you come in and this is what so today finally a week later
Yes. Yes.
Debbie knew that I wasn't going to go find a doctor, so she got her assistant to set me up with an MRI.
It's good you have people Because the average person, so after waiting 6 months to get to their primary care and spending 5 minutes with their primary care, writing the referral to maybe get an outpatient MRI, and a year later when they can't do anything, it's good you have people.
Yeah, because I'm not going to do it myself. I'm
Of
just
course
going to
not.
keep putting up with the pain. Now, you got to understand the pain is not at a 10 anymore. It's bad. I can't go work out. I can't do
Sure.
anything, but I can sit and I can stand. And when I stand up, it catches and I just have to, it's bad, but I need
It's
this tomorrow.
tolerable. I can
Yeah,
work
yeah,
through it and do my things, but it's not good. No.
exactly. So Debbie's guy calls me up and she goes, all right, we got you an MRI. This is why I've been thinking about you ever since about midday.
How
The
bad
woman
is it?
calls me from the MRI lab.
Yes.
Can you tell me your name? Tell me your birthday? Okay, it's you.
Cool.
Here's the problem. We called your insurance, and I have great
Oh,
insurance,
okay.
and they have denied the MRI.
Sure.
I said, okay. What would they suggest I do? They said, well, they want you to go get physical therapy.
6 weeks or 6 sessions of physical OT or PT before they will reevaluate and consider the MRI. Yes.
So I said to her, I said, now help me make sense of this, ma'am. You want me to go get therapy on a problem that we don't know what it is.
Hmm.
The insurance company wants to pay to have me go to someone who doesn't know what the problem is because you won't give me the test to figure
Yes.
out what the problem is.
Yes.
And then after that doesn't work, after they pay for that, and then I come back and I get the MRI, or do they think I'm going to forget that I have a hurt back?
And they will also happily pay for your narcotics, your steroids, your muscle relaxants, your specialty physician visits,
Right.
which essentially put off the problem. It's because it's a coding thing. So insurance companies, and I'm not demonizing the entire industry, are very challenging because so we have a system. It's called the ICD-10 code. How do we code somebody? So if you come in and say, oh, I have broken finger, there are probably about 40 different variations of broken finger that we can code for. And how you code for something increases or decreases the likelihood the insurance will pay for it. So if you had gone to your doctor and said, I have this problem. And oh, by the way, so the red flags that we talked about, right? I have a history of cancer, which you do. You
Mhm.
have a fever, you have instrumentation, urinary retention or loss of urinary continence. You either can't pee or you're peeing all over yourself, or loss of groin sensation, something we call cauda equina syndrome, which is an acute neurologic process. They will pay for an acute MRI. Now, generally, I'm an emergency room doctor, and so by definition, I cannot know anything about your insurance status. I can't. I'm supposed to treat every patient equally, and I try to. Um, but you're doing an outpatient test. Now, here's the kicker. If you went to an MRI center and your doctor sent you there and said, I'm going to pay for this out of pocket, not with insurance, you could get your test.
Right.
And you could probably get it at a much lower fee than the insurance company, because they don't have to deal with the paperwork, the processing, CMS, all the
I know
whatever.
all that stuff,
Yeah,
but
of
yeah,
course. It's
they only
frustrating, right?
they only knew about one of my insurances. They knew about the Blue Cross Blue Shield,
Of
right? That's
course,
the
yeah.
one I gave
Mhm,
them. I have
mhm.
two.
Oh,
I
okay,
have
so you have
two insurances, right? So when I get there tomorrow, I'm going to tell them about the second one. So where the first one doesn't pick up, the second one will.
sure,
The second one is actually the better insurance. It's
good.
Screen Actors Guild. My wife is an actress, and
Is it really
we
good
get,
insurance?
oh,
I
it's beyond. But
really?
here's the catch about Screen Actors Guild. If you're not a working actor or actress, they cut
Mhm.
your insurance. So the
So
ones that need it
what's
the most,
working, may I ask? Because there's
she's got to make X amount of dollars as an actor
okay,
per year.
okay.
Yeah,
So
she's
it's
got
not
to
like
get
time between jobs or things of that
no,
sort.
because sometimes actors, so a lot of times what actors, sometimes you'll see an actor and you'll go, what's that big time actor doing in a Netflix special? Although now they all do all of it all the
Sure.
time. if they're between movies or whatever and there's too much time and they're about to lose their SAG insurance,
Sure.
they go and do something to make X amount of dollars to
Oh,
get their
that's
SAG.
interesting.
Yeah,
I did
that's
not know
always
that.
been the same. Yeah,
Huh.
and my wife barely works as an actor anymore. She's 63 years old, and she was on a soap opera last year for 40 something episodes. So she'll do
That's
things
awesome.
to just to keep her insurance going. But
Of
sometimes if
course.
she goes too long, they drop it. Right?
See, you do need to do that documentary in Italy. Then way you'll get your Screen Actors Guild
Yeah.
insurance.
No, I can't get it because I do non.
Oh, that doesn't count.
Yeah, I don't do. You see, I get it because my wife, the spouse gets it. I get it
Oh,
through my wife.
so she needs to do the
Right. I don't
documentary
do
in
anything.
Italy.
I don't do anything. I do everything away from the industry. I hire
So
industry people on the side, and they do it, and they're not supposed to.
gotcha. Well,
Right.
I think when your wife does the documentary in Italy, as she should, and then you film the documentary and you're the face of the documentary, I think
Mhm.
you probably need a physician to go with you. And although it seems like you have a good relationship with Debbie, I'm just saying, as someone who's very into keto, because if I say again, you saved my
Yeah,
life, so
Debbie's
you
not doing
should take
taquitos.
me
Yeah,
to
yeah. I
Italy.
should
Yeah,
bring
you
you
should take
instead
me
of
to
Debbie.
Italy. Yeah, I would make that
Yeah, it's
sacrifice.
like, Deborah, I love you and everything. You and Coastie are great people, but I'm going to
But
go in a different direction this time.
I'm
Um,
gonna go
yeah.
keto in
Okay.
Italy.
So isn't it maddening? And then I told the woman on the phone, I said, listen, I'm not going to physical therapy. Physical therapists never do anything for you. And I'm in pain right now.
Mhm.
And you need to go call them back and push this through. And she simply said, okay. And she
Yeah.
called me back 10 minutes later and said, okay, they pushed it through. So why is
I'm
it?
shocked. I'm shocked.
Because
Well,
I'm
no, I'm shocked it took so short period of time. Usually doctors are on the phone for hours doing these things.
I'm very convincing. I said, when you call them back, say these things.
Yes.
Say these things to them. And I gave her a bunch of things to say. I'll tell you off the air. And she did. And they called back and said,
Beautiful.
she goes, yeah, they said they were doing it. Now, when I go in tomorrow, I'm going to give them my backup insurance and that covers the
Of
difference. And
course, of
then
course.
we're all good. I don't have to pay a dime, right? Because I pay a lot for two insurances. I shouldn't have to pay a dime.
So I'm going to guess. So when we talk again, this is what I'm
Mhm.
gonna guess your MRI is gonna say based upon what you're telling me. Um, it is probably gonna show probably lumbar 2, 3, 4, or 5, sort of in that area, is probably going to show significant degenerative disc disease, duh.
Mhm.
But you're probably going to have what's called an acute annulus abnormal, so a acute disc herniation, which is impinging upon part of your cord, but not part of your cord that is controlling your bladder, your bowels, what we call that cauda equina syndrome. Based upon like everything you told me about your history and the symptoms, and then whatever you did, whatever that acute inciting event was, went from, oh, I have a horrible back to, I have a horrible back, and now something happened. The fact that you're able to go periods of time in between says that, sure, you have a bad back, but something acutely has happened. It's probably not just as simple as a pinched nerve, although that's certainly part of the problem. But I will bet you dollars to donuts you're going to have something. This is where my list is going to,
Okay.
spondylolisthesis. I have a little bit of a lisp. Punched in a face too many times. So, night shift. But I'll bet you it's going to show that. And they're going to say after that PT and OT. And I will say a really good physical therapist can do miraculous things, but it has to be a very specifically sports related. And that seems silly to say sports related physical therapist,
I've
but
been
you
to
have to.
listen, I've been to physical therapists about this back over
Yeah.
the
And they
years.
haven't helped.
They don't know. They see me walking in. I'm a guy that
Mhm.
was lifting weights that morning and doing squats
Sure.
and deadlifts and everything else. And they'll say, okay, take this 5 pound weight and walk across the floor. It's like, are you fucking insane? Are you, are you out of your mind?
Right.
I just left the gym where and now you got me with a 5 pound weight walking. So you could go talk to the old man on the machine that you got doing that. They're
Mhm.
trying to do 3 and 4 people at once. They're not paying attention
Mhm.
to one person. They don't give a shit. They're pumping 3 people through that, and they're making money, and they're not paying attention. And I know someone's going to write to me and go, not all physical therapists. I get that. Not all of them, but good luck finding one.
Oh, absolutely.
Good
You need
luck.
kind of a concierge physical therapist. Again, somebody who specializes in sports. Actually, if I may make a suggestion, if you can find a physical therapist who specializes in dancers, and why do I say that? Dance specific physical therapists have to do very specific training related to repetitive stress injuries. And a lot of dancers have a lot of repetitive back injuries. They are very, very specific and intentional in their PT, and they do it a really different way than the average physical therapist. I know it seems like a very odd suggestion, but believe it or not, they tend to have really, really good results because they are very individualized in their because dancers are so different. So
Right.
I'll just throw it out there. It might be there's some free and cheap medical advice
You
there.
know, listen, if I could find a good one, I would. My good buddy I went to school with, we were in class together. I
Mhm.
almost went into PT.
Oh,
Gus
interesting.
Gutierrez runs a sports physical therapist down in Baton Rouge. I would trust Gus, but he's 1,000 miles away.
Sure.
You know, and by the way, I'm a guy that gets on the floor every morning and stretch for an hour. I
Yeah.
look like a cross between Sylvie Guillaume and Baryshnikov. I stretch every morning. Not
Wow.
right now. I can't.
Of
I
course.
can't. I mean, getting on the floor and just laying there and compressing my vertebrae into the floor just
Mhm.
to relieve the pain. That relieves the
You have a
pain.
TENS unit?
I do, and I haven't hooked that up to me yet. It's I need to fire it up. I haven't.
Fire it up because it's not going to fix the underlying problem, but it may distract your nerves enough so it gets you at least to the point where you can have a diagnosis and do something definitively to fix the root cause. But TENS units are somewhat magical in that in a very similar way to so gabapentin makes the nerves not hurt, they're less inflamed. TENS unit doesn't make the nerves better, it just makes you not think the nerves hurt. That's kind of the simplistic way.
I'll take
You
whatever I
should.
can get.
No, you
Yeah.
should, and fire it up as high as you possibly can, and then go lower. Don't do low and then high. I know it's the opposite to the way people think, but, uh, speaking as someone who suffered from sciatica for decades, um, it was one of the very few things that let me go work a 12-hour shift. Sometimes I was dragging my leg, but it let me at least not care. I could drag
Right.
my and I've gotten to the point as the mother of a lovely child who's way into her happy middle age. I let's just say that one cannot make it from many, many hours without going to the bathroom. So I feel your pain on that one.
Yeah. I'm going to take a quick break here to do an ad, and when we
Okay.
come back, I want to talk about what got me interested in you watching your TEDx,
Fantastic.
and which I thought was pretty amazing. And
Oh, I'm so honored.
yeah, let's get into that right after I tell people, folks, that we don't get the proper amount of nutrients that we need from food. And there are vitamin companies that can help you out. The problem is most vitamin companies, they put excipients and flow agents and titanium dioxide, and some of them even add sand to the vitamins. When I learned all of that after my first round of cancer back in '07, I decided to make the world's purest vitamins, and I called the company purevitaminclub.com. This is not a joke, folks. I make the purest vitamins. I'm not saying that because I own the company. I'm telling you why I started the company. And when you get serious about taking vitamins, you want to take purevitaminclub.com vitamins. So go to purevitaminclub.com right now. I know what you're thinking. Wow, if he's making these vitamins that pure, it must be awfully expensive. That's where you're going to be shocked. I made a Rolls Royce and I charged a Toyota price for it. So go get the Rolls Royce of vitamins and pay Toyota prices. Go get purevitaminclub.com right now. It's my company. You will love what you're getting. You'll love the way you feel. We are talking to Dr. Amy Gutman. And Amy, you came to my attention because I don't know if you sent me or someone sent me your TED Talk. And folks, you have to go watch this TED Talk to believe it. But we're going to have you, even though she's going to tell us what it is, you still want to go see the TED Talk. You had a patient walk in. Now,
I
wait a minute.
lost you.
Oh,
Oh, we
there I
lost
am.
you a little bit. There you are.
I'm back.
So
So,
it's the sunspots today.
yeah, it's got to be. You had a patient walk in. Was this into the ER or was this?
Yes.
Explain to us what happened, beginning, middle, and end, and don't leave anything out.
Sure. So my TED Talk, and thank you so much, is called Patients Are Hurt by Kind Lies, which they softened the title because the title was actually How Patient Satisfaction Harms Patients. I actually got slapped with a TEDx trigger warning because they said it stigmatizes obesity and drug addiction. And which I think it's interesting that I got a trigger warning for something that is about how trigger warnings harm patients. So, how kind lies harm patients. And what had happened, this is obviously very HIPAA compliant years ago, and I don't name patient details because she's also one of many patients, but she's the one who changed my life in that I'm a night shift emergency room doctor, and a lot of my patients are there because we always say they're sick or they're sad. So this woman had come in and very heavy, 400 pounds, young. She was very young. She was in her 20s and had every obesity related illness that she had. She had kidney issues. She was a diabetic. Um, she already had, heart disease. She had everything you could name. And she came in because she said, well, I'm in pain and I need narcotics. It's the only thing that fixes me. And we have a system in the emergency department that we can say, it's not every state, but it's like how many emergency department visits or pain management or doctor visits and how many prescriptions have you had for narcotics? And this woman had like a record. It's called a PDMP, the Physician Drug Monitoring Program, and a 0 is someone who has none. And some people have like a score of 50 or 100. They had a surgery, they got a few drugs after surgery, fine. And this woman had a highly elevated score and multiple visits. Plus, she was getting scheduled narcotic prescriptions from a pain management physician for years. And the CDC actually says this over 3 months doesn't even work. But it was like instead of 30 days, she'd run out in 27, then 25, then 26. So she was overusing and then going to emergency departments. She did not want to talk about her weight because her sugar was high, because she was heavy. With a history of diabetes, we always check your sugar. Sugar was high. She didn't want to talk. So I said, hey, let's talk about why your back is hurting. What I had talked to you about, like, what are the red flags? Are you having red flags today? Did something change? Because the last thing you want to do as a physician is ignore a problem and say, you're just heavy and therefore it's nothing and move on. That's the wrong thing to do. But you cannot take a patient's exam out of your diagnosis. And
Right.
part of her exam is you're 400 pounds. So has something changed? And it may have, but in that case, it didn't. What changed was she was out of narcotics. Her sugar was very high. Okay. So I said, let's talk about this. And she said, no, I don't want to talk about it. I just want you to fill a prescription, give me some meds, and I want to go home. Not
What
the right thing
med was
to
she
do.
looking for?
She was looking for narcotics. She was looking for Percocet or oxycodone, some form of narcotics. She has
She didn't
already
care
been on
what
most.
it was. She just
No,
wanted a class C of some sort.
absolutely,
Okay.
absolutely. And she had multiple prescriptions from multiple providers, and she didn't want to die. I said, no, because it's inappropriate. They're not used for chronic pain. They're not indicated for chronic pain. In fact, in the emergency department, we have what's called a chronic pain exemption. So, meaning you have come in, let's say you have chronic pain and you have fallen and you've dropped a dumbbell on your big toe and you
Right.
happen to have a long term prescription. I can give you 3 days of something else in addition, but it's 3 days. That's it. So you'll see a lot of patients every 3 to 4 days going to a different emergency department, different emergency department, different emergency department. So I tried counseling her,
So
which a
wait,
lot
hang
of
on. I need to
yeah,
understand this because
please.
I
Mhm.
understand this is drug behavior.
Yes.
So, I have a problem.
Mhm.
I'm taking Valium.
Sure.
I can keep taking the Valium, and you will give me a 3-day prescription of something on top of that, so I can double up my
Potentially.
Valium. And
Potentially. That's potentially. It depends on the circumstances. So let's say you are a cerebral palsy patient.
mhm.
and you are plagued by, you have muscle spasms, and you come in because you catch flu A, and you're in agony because your baseline level of pain is now increased because you have an acute inflammatory process.
Right.
So we look at that patient and say, based upon what I'm seeing right now in front of me, I have a little bit of leeway that says I can maybe adjust your medication schedule. It is not the I'm on chronic narcotics, oh, I need more because I've run out or I don't have anything new. So it's called an
Got
acute
it.
pain exemption. And I think it's very reasonable because theoretically the only patients who should be on chronic narcotics, why it was initiated as the ridiculously, pain is a fifth vital sign in 1996, was we have cancer patients, but people, that's why narcotics were invented, were patients who are cancer patients who have horrible metastatic disease to their bones and joints and things. It's horrible. It's
Right.
unremitting pain that I can't even imagine. But different types of people have pain. So needless to say, she didn't want to talk to me and she yelled. And a lot of physicians will not even attempt to counsel patients because of the fears of repercussions with patient satisfaction scores. I don't care. And I hate to say that because I'm an old cranky woman and I don't care about my job. I pay the mortgage. I do care about my job. I need to work. What I
Right.
care about is doing the right thing for patients because this is the wrong thing. So she yelled and screamed, and I'm going to write you up and F this and ran down the hall. And I didn't really think much of it because it happens innumerable times a night. Didn't think about it.
Right.
I thought it's a shame. Didn't think about it. So a few shifts later, I was working same emergency department, and they called a code from the field. And when they called a code, they have unconscious, unresponsive, no pulse, CPR in progress. Okay. And we try to get some basic information that helps us prepare in the emergency department. Young female, unknown age, morbidly obese, found down, unknown downtime. Okay. She comes in, and I recognize her hair. Her hair was a very distinct color. I didn't recognize her because people look very different, believe it or not, when they're in the throes of resuscitation. I recognized her hair color. And I'm like, you got to be kidding me. And so we worked her. They worked her in the field. We actually got a pulse back briefly. We were very unsuccessful. So when I'm doing her death notification and the note of what happened in the emergency department, I'm looking through her medical records and that PDMP that says what has she in the 2 days. It was well, no, 2 shifts, so about 3 to 4 days. She'd been in 2 different emergency departments and got 2 different prescriptions for 2 different narcotics. Because, and I don't know the circumstances, I would bet you dollars to donuts. The physicians who prescribed those meds did not want to, they're like, fine, dear, here takes 3 days. What is 3 days going to harm you? And then
Right.
another one did. And I remember at her autopsy result, which I'm privy to because it was an unexplained death in a young person. Yes, she was heavy. Yes, she had multiple medical problems, but it was unexplained. She had multiple narcotics in her system. Her sugar was sky high when she died, which is not always a great indicator because you've passed.
Right.
And at least 2 physicians, because it takes sometimes up to 3 days to get into the PDMP. I couldn't see their notes. They were in a different system. We can't see every hospital note. And I sat there and I just stopped. I was so angry at my profession, who I love. I am proud to be a physician. I'm proud of the work we do. But I'm so angry at that moment that this is a life that was wasted. No one, no one had taken the time, or no one explained that, you're going to listen. I would love to save your life. I'm not a hero. I'm not saying anything radical, but someone has to talk to you. It's unethical, it's not moral, and we have a legal obligation to talk to our patients about this. And I started looking at patients really differently, and I looked at my profession differently. Patient satisfaction comes out of the idea that happier patients have better outcomes, and that is not been found to be true in multiple studies. What it found is patient satisfaction does decrease your ER visits. That has been shown. Why? Because patients with unhappy events, they don't give us good satisfaction scores in the hospital.
Right.
Patients who have high satisfaction scores tend to have higher mortality, higher length of stay in hospitals, higher utilization of the medical system, higher use of medications, higher use of surgeries. So
So
not
what you're saying is
mix.
it's the opposite of what it should
Absolutely.
be.
Absolutely.
It's bizarro world.
It is bizarre world, but here is why physicians are afraid to counsel. So 30% of a hospital's reimbursement from CMS, the Centers of Medicaid and Medicare, are 30% of what's called value-based productivity, so VBP. That is how the hospitals look at their scores, or the government looks at the scores every year and say, what is your quality? The idea is quality. We want to have good quality care, of course. But 30% of the reimbursement of the money paid from the government to a hospital is based upon patient satisfaction. And so physicians who don't make their patients happy, who don't give good patient satisfaction scores, that get reported to the government, and the hospital loses millions of dollars. So that trickles down. And about 80% of physicians have reported, and this is pretty consistent over the years between surveys, that they feel pressured to provide a service to a patient. Oh, my kid has an ear infection. Well, here's an antibiotic. Why didn't you give me an antibiotic? I want an MRI in the emergency department right now at 3 o'clock in the morning. I want this. I want a narcotic, which is not indicated. 80% of physicians say they're pressured to do it. And 50% of physicians, again, across the board, all specialties, have said they have done something because rather than confront a patient, counsel a patient, or a fear of having a low patient satisfaction score, causes them to do something that is not standard of care because they felt the pressure. It is not a patient problem. It is not a physician problem. It is a system problem, our sick care system. And it's a very difficult thing because, as I say in my TED Talk, I never intend to offend. I don't. But the biggest thing on Google, if you look at me, I wouldn't go to me if I read my Google reviews. I'm a horrible person on Google. I'm
Right.
condescending. I'm mean. I came in for this and she refused to, and she's a horrible doctor. And I complained to her supervisor. And yeah, it happens all the time because I try to base my care on the individual and what they need and what's the right thing to do. That's a difficult thing when you have to maintain a job. It's a difficult thing when you have to pay a mortgage. It's a difficult thing when you try to be ethical and use evidence-based standard of care. And everything you do, your system's saying, we're going to make it as difficult as possible. So this patient really changed the way I look at patients in general. And at that time, I was very metabolically unhealthy myself. And one of the big things, and I think Dr. Tro, who is so interesting, is sort of like, a random Twitter person who's an amazing physician who's done amazing things with his patient. He and I sort of share a past in that we were both morbidly obese. I was a vegan for 37 years. And physicians will not counsel patients on things that physicians who smoke will not counsel patients on smoking. This has been showed in multiple studies. Physicians who are obese will not counsel patients on obesity.
Right.
Would you like to know the one group of physicians that will counsel a patient? Take a guess.
I'm gonna say it's vegan doctors.
Diabetics.
Really?
Physicians who have type 1 diabetes, and specifically type 1 diabetes.
Oh, okay. So
There's
not the one you caused.
Not no, but physicians who have type 1 diabetes tend to be very, very aggressive in counseling their patients. So I find that really interesting because that group specifically stands out. But heavy physicians will not counsel patients on obesity because that's shame and blame culture.
Right.
Yeah, vegans will always what is it? How do you know somebody's vegan? Well, they'll let
They'll
you know in the
tell you.
first 5. Yeah,
Yeah.
yeah, I know.
How you know someone runs marathons? They'll let you know right away.
Absolutely.
Um,
Absolutely.
So yeah, look, my good friend, I don't know if you know Mark Cucuzella, but
Yeah, we're not friends. I certainly know of him. Yeah.
great guy. He's on the show a lot. Pro
Mhm.
Calasian is on the show a lot.
He's amazing.
He
Brilliant.
he is. He and his wife are wonderful people. As a matter of fact, he wrote to me earlier today, and I think I have to get back to him. But Cucuzella, he goes, he's a great doctor. He tells people the truth, and everyone in his practice is like, you need to stop doing that because you're
Right.
you're screwing us up,
Mhm.
right? But if we don't have if we don't have doctors telling people the truth, then we're done. We're
Right.
done as a society. I started reading articles about 5 years ago where it was like, oh, doctors, they don't even weigh people anymore because they don't want to get the basic thing every doctor's done my entire life: hop on that scale.
Yeah.
Hop
They
on the
will not
scale.
they won't weigh patients because they said it's shaming them. A
Yeah.
lot of medications are weight based. You did chemo. Chemo is weight based.
Oh, yeah.
Chemo, pediatric. I see the youngest patient I have seen in the past 5 years with an acute cholecystitis, acute gallbladder attack. So he's a 8 or 9 year old, 180 pounds and about 3.5 feet tall. Came from a heavy family,
Mm.
and the mom's like, "Well, everyone in our family has their gallbladders out." Well, let's chat about why. And there is a time and place. So I've got an 8-year-old terrified kid who's going to go to surgery for an absolutely preventable problem. That is not the time and place for me to do an intervention. It's just
Right.
not. It
Right.
is the only intervention because they wanted to feed the child because they said, "Oh, he gets hypoglycemic. That's why he has to eat all the time. His blood sugar drops." All right. Please don't feed him. He's going to the operating room. That was my intervention. Not the time and place. Primary care doctors, I touch up at this in the TED Talk, they've got an average of 15 minutes. That's not every primary care
It's
doctor.
crazy. It's crazy.
15 minutes. And so it's your intake form. Let's refill your prescription. What did your labs do? When, and I'm sure you have a good relationship with your primary care. When is the last time that you heard from somebody that a primary care physician actually laid hands on them? Patients, they come in, they turn on their computer, they go, "Hi, nice to meet you," shake hands on their computer. So I see that da 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 da. Okay, let's listen to my legs, whatever. Or let's just order stuff. It's not that they're bad physicians. I have dear friends who are primary care physicians, internal medicine doctors. They have to see 30 patients a day.
Well, that's what the woman I just told you about, his close friend.
Yeah.
She says the same thing. We don't have time to be doctors.
Mm-mm.
Every doctor I've had on this show will, off the air, sometimes on the air, will say, if I don't see, every 12 minutes, I need to be walking in to see someone else.
Yep.
We don't have time to heal people. It's all sick care. It's not health care. And
Right.
I've been hearing that for years. So the question becomes, how do we turn that around? Before you answer that, folks, I need to tell you the best way to turn anything around is by eating olive oil. You can't really eat olive oil. You can eat olives, but you can drink olive oil. And I know what you're thinking. Wait, drink it? Oh, yeah, I drink it. Yeah, Serena will put it on a salad. If she could get me to eat a salad twice a week. But in general, I take olive oil as if it's a supplement. I put it in a little shot glass. Sometimes I'll put it in my little espresso cups and I'll drink it down about an ounce a day. Olive oil is very healthy for you. Now, here's the deal. Not all olive oil is created equally. They could cut it up to 40% in this country. Anna and I just did a whole podcast on how crazy it is. Go listen back to the Monday show. Here's the deal. You want to get the good stuff, go to Villa Capelli olive oil. Now, you can save some money by putting in my name, Vinnie, at checkout. Vinnie. No wimpy Y. Put in Vinnie at Villa Capelli olive oil. If you can't remember the name, just go to vinnietortorich.com. There's a thing there. You can click on it, get right to it. But save money at the end by putting my name in. Vinnie at Villa Capelli. Save 10% every single time. We're talking to Dr. Amy Gutman. And Amy, how do we fix this? Where are we on fixing this? Can it be
So
fixed?
it can. I have hope. So if we can go back to the very mild fangirling, in
Okay.
talking to you. So let's go back. So I was joking last night at work, and literally last night at work, and I asked him, I said, I'm going to be on this podcast today with kind of a personal hero of mine. I said, can I talk about your stories? And they rolled their eyes like, whatever, because, social media doctor, whatever that I am. And so I have a young lady at work that we joke about, and it's like, Dr. Gutman got me pregnant. She's one of my nurses, and
Wow. Good
and
girl.
so I know I'm very good. Her husband is not so excited when people say this, but we both laugh. He's a nurse as well. And so she was having difficulty with some fertility issues, and we talked about keto diet because she said, "Hey, this thing that you talk about all the time, because I'm always ranting about it at work, does it work?" And I was like, "It's not just opinion. Let me give you some facts. We did some papers, we did some research, and knock wood, all well with the pregnancy very now. So we joke about getting pregnant. So I walk into work last night, and it's of course chaos because that's what I do. And I walk by someone, I'm like, I know this person, I know this nurse, because we usually have a pretty stable core of nurses at night who I work with. I'm like, I can't put my finger on him. Where did? And he walks up to me, and I'm like, holy shit. The last time I worked with this nurse was about 6 months ago at a different hospital, 7 months ago. And the charge nurse that night was keto. The security guard was keto. And I was actually preparing for a conference. I do a lot of talks globally about keto and carnivore and metabolic healing. And I was going through some of my slides for it, and he was looking over my shoulder, like in between patients. We had a little bit of a break, and can I see that? I gave him my slides, and he said, "Does this work? It seems ridiculous." And I said, let me explain the science behind it. And so we're doing steps. So you did a short recently about being at airport getting 10,000 steps. Well, that's at night. I specifically run around the emergency department between patients. I take the longest route so I can get my steps in. So we're running around the emergency department, and I'm reviewing the science with him and didn't think anything more about it. Haven't seen him for 6 months. He's 70 pounds down. He has reversed his diabetes. He's reversed hypertension. No longer has fatty liver. He looks amazing. Did not recognize him. He and his wife have done the same thing. He gave me a big hug. He goes, "Thank you. You saved my life." And I said, "I'm passing it on, and nothing makes me happier. Nothing makes me happier. Like, I get such joy from it." And I had been a vegan for 37 years. I did not really have a need for a primary care doctor, and I got super sick, like incredibly sick. Thought I was dying sick. Everything went wrong at once when I hit menopause. And I've always been a bit heavy my entire life, a vegan who frankenfoods, the Beyond Burgers and all that, because it's healthy. That's what I thought. It was healthy. Seed
So wait,
oils and
so
vegetable
how
oils.
when did you hit menopause and when did you get sick?
50s. So I hit menopause in my 50s, and I got super sick. And it started with just a little hot flash, and then I got the whole cadre of vasomotor symptoms. I had developed something called sick sinus syndrome. I went heart rates from the 30s to 170s would drop me like a rock. I was having hot flashes so bad, like we'd put puppy pads on the bed,
Wow.
because it was awful. Sort of thyroid out of control. I'd been on thyroid medicine since I was a teenager. Everything was broken. I developed rashes so bad. I was oozing blood so bad. I would have to wear stuff at work to cover me head to toe because you were risk for infection at work. And I dropped a ton of weight. So I'd always been a bit heavy, but very active. I'm a very active person. Did baby triathlons and all that. No ultra marathons for this one. And I dropped from, like, my happy weight's like 120, 125. I'm 5'1", happy, I'm strong.
Yeah.
I dropped to 92 pounds, and everyone's like, "My God, you look fabulous." And I'm like, "Oh, I'm a size 0. It's great." I couldn't put weight on. Everything was making me sick.
Wow.
Everything was making me sick. So I'm like, I approached myself as a traditional doctor would. I'm going to do a heart healthy diet because, lots of grains, lots of this, oh, I just got worse. I don't know what to do. And I stumbled upon, I'm like, I remember a TED talk from Dr. Terry Walls about like ketogenics. And I'm like, this is interesting. Huh. And I went back to, why does it work in epilepsy? Hippocrates, let food be thy medicine, medicine thy
Yeah.
food. And I looked at the science behind it, not just the tree hugging. I thought it was very woo woo. I'm like, this is ridiculous that I can heal myself by eating meat. And I watched you're beyond
But before
beyond
you get
food.
into that, folks,
Yes.
if you ever wanna hear some great podcasts, go back
Oh.
to my old shows, find Terry Walls,
Oh,
or just
amazing.
look her up online, WHALS. This woman cured
Brilliant.
herself. She was in a wheelchair making rounds. She was a doctor making rounds at a
A
hospital.
electric wheelchair, not even a
Yeah, that was
self-powered.
laid back, right? Like
Yes.
she could, and they were trying to figure out, how do we get her off the floor? We can't just have this doctor going around. She could barely move.
Yeah.
And she and her wife, Terry's lesbian, she and her wife started down, just eating meat and eating keto and following along NSNG and the whole thing. And she created what's called the Walls Protocol, which is the same as NSNG. It's the same exact thing. There's more vegetables than what Terry does,
Sure.
but it's
And no eggs.
meat. Yeah, there's no eggs. But she's got some
She's
weird things in
allergic,
there,
yeah, I know.
but it's coconut oil, it's olive oil, it's high fat. The woman started. She, I want to say, had a son or a daughter. Before you know it, she's riding a bike with the kid. There's a woman that was in a wheelchair, an electric wheelchair, hiking again with the kids and the wife, and doing everything, right? Just right back to doing it all.
Yes.
Mountain biking. The Terry Wall story is pretty amazing. So it's amazing that you came upon Terry's story and that started healing you.
It did, because I'm like, I remember watching this and I thought it was remarkable. And I'm like, well, this is really interesting, but I didn't think anything of it because at the time it didn't apply to my life. And I'm like, well,
Right.
why would it apply to patients? And but I'm very science driven. Everything I do, I try to base on evidence. And as I sort of dug, I'm like, the evidence doesn't make any sense. What I thought I knew was absolutely wrong. Obviously, all the things with the AHA and the American Diabetic Association and the funding, it's just, they make a problem, make the food that makes the problem, then make the treatment for the problem. And it's been very well documented about the fraud in that. It's not a conspiracy theory, it's very well documented. And I saw your documentary on the Beyond Burgers and the sort of the Franken foods. I'm like, my God, this isn't healthy. And of course it's not. It's industrial lubricants and all this processed. But then I'm like, I think I'm going to try keto and Dirty Keto. So I watched Dirty Keto. I'm like, so this is a normal guy. You're normal. You're not a scientist, but
Right.
you hit upon everything in that documentary that made sense to me as a core, as a scientist. Dr. Teicholz, and I'm like, this makes sense. Dug more. And then one day I was having a really hard time getting out of bed because I'm like, I am going to pass out. And I said to my husband, let's go get a hamburger. We live in a town that's has a little bougie little restaurant that is like, farm to table regenerative. I said, let's go get a hamburgers. Let's go get a CAT scan of your head. This is ridiculous. You clearly are dying of something. A hamburger. 37 years as a vegan. Now, at that time, I'd actually started adding some fish back in because my body was screaming at me. And I had the hamburger, and he's watching me the whole time. And I'm like, all right, all right. So 3 days later,
So
3 days,
somehow
he
Amy has locked
says,
up.
what's
Let's
going on
see.
with the hot flashes?
Okay. We're back. So we
Oh,
lost Amy at, all right. You're eating the hamburger.
I'm eating the hamburger.
Right.
And hubby's watching me. In 3 days, I did okay. And I started eating meat and started eating eggs. I'd never really done that. And in 3 days, he goes, what's going on with your hot flashes? It's a little bit cutting down. And I had gotten like one of these little watches at the time.
Right.
And I'm like, it's really weird. My heart rate's still going from like 150, but down to 50, not 30 to 170. It's interesting. 5 days in, my rashes started scabbing over. And I had
Wait,
had
I want you to be
really
clear, Amy. I want you to be clear.
a week, 5 days.
You're now eating hamburgers every day, or what?
Hamburger, I'm eating ground beef, I'm eating MCT oil, and I'm butter in my coffee. If it wasn't a whole food, it went away. I stopped eating vegetables altogether because I had read about oxalate theories and all. I'm like, I'm gonna elimination diet,
So you didn't
anti-inflammatory,
just, I
clean.
want to be clear. You didn't just eat a hamburger one day
Nope.
and then 5 days later. You ate a
No.
hamburger, realized it didn't kill you because listen, I had a girl that used to do my Wednesday show with me,
Yeah.
Gina Grad,
Mhm.
and Gina hadn't eaten meat in like 25 years, and
Yeah.
she kept going. She would tell me off the air, "I want to try meat, but I'm told that you have to re-entry to meat, re-entry." And I said, Gina, I know the longest term, most vigilant vegan in the world. Excuse me. Her name is Lear Keith. And Lear's been in my podcast.
Mhm.
Lear's been in one of my movies.
Mhm.
I'm choked up even talking about her. And I said, Lear Keith was a vegan for almost 40 years. And one day just ate like a New York strip or a sirloin. And it was almost like the light went on.
Yep.
She always thought that her stomach was going to knot up. It's almost like, throwing a fish back in water, right? They need that oxygen in the water to,
It
well,
heals the gut biome by giving the gut what it
almost
needs.
immediately. Vegans will tell you, oh, if you go back to meat, your stomach will get twisted. You'll be in the
No.
hospital. You'll get the shits.
No.
Everyone, I said, Gina, the longest term vegan I know went back one day, ate a piece of meat, immediately felt better.
Yeah.
She's like, really? I said, I tell you what, you want to try meat? There's a place in LA called The Counter. I
Okay.
said, go to the counter, just get a burger, no bun, no nothing. Just tell me you want a burger, put a tomato on it, do something.
Yeah.
She called me and she was like, my God. It was almost like she was having an orgasm. She was like,
Right.
I haven't felt like this. I thought I was going to feel bad. I told my
Mhm.
husband, make sure you watch the kid tonight and the whole thing. She's like, I feel things I haven't felt. She
Yes.
goes, it's one piece of meat just opened her up. She started having meat every day, every single day, and became a different person.
Yep.
Right. And I'm hearing the same thing from you within a
100%.
few days.
Within a few days, and it was remarkable. So by the end of 14 days, I'm like, I part of the whole vasomotor issue is I started developing like horrible disabling migraines. Couldn't see, lost peripheral vision. My vision got really bad. By 14 days, I'm like, oh my gosh, I feel amazing, but my vision's getting terrible. I can't see anything. Well, I was on 3.5 cheaters, and in 14 days, I was down to 2. There were 2.
Wow.
Like, oh, my vision wasn't getting worse, it was getting better. So a month into this, my rashes are almost gone. My heart rate is kind of stabilized to like the 60s and 70s. I was every now and again having spikes.
Hmm.
Hot flashes were down to maybe 5 or 6 a day. Symptoms had completely gone. GI bleeds, gone. Now I wasn't particularly thrilled because I gained 20 pounds. I'm like every carnivore is like, I've lost 70 pounds. I'm like, I gained 20, but I
Right.
needed to. Right.
You
I
needed to put
needed
some
to.
muscle on. You were down to
Right.
90 pounds. I mean,
Absolutely. It was ridiculous. And so I like, this doesn't make any sense. My sugars had stabilized. Obviously, no sugar, no grain. If you're not eating sugar, you've switched to ketones.
right.
And I'm like, this is magical.
Yeah.
This is not woo-woo science. The evidence is there. And it became very, very difficult to do my job again in the emergency department because I see patients coming in. So I tell the story. I told the story at a conference that I had a lovely woman in her 60s, had been an insulin dependent diabetic for decades, very well controlled. She got a new doctor who didn't know her very well. And she said, hey, I think you should be eating more fiber. So you can have apples. And she go, oh, apples? Yeah, but they have a sugar in them, don't they? She goes, no, no, it's fiber, so it doesn't count. You can have up to 10 a day if you need it. So she comes into the emergency department. And again, permission to tell her story, HIPAA compliant, of course. She was in something called diabetic ketoacidosis, DKA. And what that means is your sugars are so sky high, you have to go into insulin drip. Toxic. This woman injured her kidneys. This woman injured her heart. This woman injured her entire system because she was given horrible advice by a primary care who was trying to do something good for this woman who it's like, oh, fiber doesn't count as a carbohydrate because it doesn't raise your sugar. Apples, it's fruit. It's healthy. It absolutely is not healthy. Smart woman. And I see stories like that every night. 85% of the patients I see in the emergency department every night are there because of absolutely preventable illness.
Yeah.
85%. So goes to your question, can we fix our sick care system? Absolutely. How do we fix it? We fix it with metabolically minded physicians who address the root cause of
But
disease.
we still have, no matter how much RFK Jr. we have
Right.
out there, we still have the prisoners running the asylum, right? When you
100%.
have Unilever and all of the big food companies giving money to the AHA and
Yep.
the ADA, and
Who
they're
just
controlling.
recently said it was in a Congress or in Texas or something where they said, oh no, it's important that we allow people to have funding to have soda.
Well, yeah,
And
they were trying to
yeah,
cut soda from the SNAP
yeah,
program, and
yeah,
I think a couple of states actually did it, and
yeah.
they're calling those states racist states now. So
I
it's like
know,
they turn everything into racism. I don't know
of
how they
course.
do that or why they do it, but yeah, I mean, we're trying to heal people, and they're going, no, 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 no. They need their Coca Cola. You can't take Coke off of SNAP because Coca Cola gives millions of dollars to the AHA and the
Of
ADA.
course.
Folks, if you don't know, that means the American Heart Association, American Diabetes Association,
Yep.
they've been telling dietitians to tell people for the past 75 years
Hmm.
that there's somehow miraculously some kind of difference between eating a potato and eating sugar. The only difference is the potato will raise your sugar just as high as the
Yeah,
sugar will, but keep it up there for longer. And
absolutely.
the bottom line is I used to say, people used to go, well, Vinny, you're nuts. You don't know what you're talking about. You're not a doctor. Okay, great. Now we have a little something called CGMs,
Absolutely.
continuous
Actually,
glucose monitoring.
I got mine up right now. You can't see it
Yeah.
under, but I have mine. Yeah.
So if you think I'm lying, go get a CGM, because once you see, you can't unsee. So now you don't have to worry about old man Vinny going, that's killing you. Go see for yourself. Go put a CGM on and eat a potato and see what happens. Put a CGM
Absolutely.
on and have 10 apples with all your fiber in it and see what happens. You're going to see that you're going to get the same kind of glycogen spike, glucose spike, or glycogen load
Hmm.
that you would get from eating pasta, apple pie, Snickers bars. Your liver is a meritocracy. It doesn't care. Your liver
Your
is going
liver
to,
is a meritocracy.
it's a meritocracy.
That's actually so it's brilliant.
You
That's
can't
I
use
love it.
that. I've
Doesn't
been using
care.
it for years.
I
Yeah,
may I steal it? May I steal
yeah,
it?
yeah, knock yourself out. Just say Vinny told me this.
Vinny
So
told me.
your
But
liver,
here's
your
the
liver is
thing
the
about the
OC bank,
liver.
right?
So
It does what you give it, and that's it.
and in regards to the glucose, it's not just, oh, my glucose is high. So the pro inflammatory state of having that glucose high causes your diabetes, your hypertension, your atherosclerosis, your fatty liver disease. And so when it ties back to obesity, and so the whole idea of patient shaming, I am not telling you you're fat because you're a bad person. You have made some bad choices. And I cannot tell you the number of patients who like, I had no idea that obesity causes cancer. Absolutely, it does. I think when the big hoo-ha when Cosmopolitan put a very heavy woman on her cover and said, "Oh, this is healthy." It is absolutely not healthy. Now, the fact that she's exercising, great, amazing, fantastic. These are steps that we take to be healthy. But health, you cannot politicize health. There, you just can't. It's health or it's not. It's evidence or it's not. When you politicize it, and I think that's where some like RFK is a bit polarizing in that for some reason it's become political to say to somebody, hey, take out artificial sweeteners, ultra processed foods, and things that aren't whole foods, which we know cause cancer, cause diabetes, cause heart disease, and eat more whole foods. Somehow the message became that's political. I don't know why, when the evidence is clear, our diets are killing us.
Well,
And
look,
as a physician, I have to talk to patients about that.
there were two women, both very talented. One is Lizzo,
Hmm.
and the other one was this British singer that won a bunch of awards.
Oh,
Karen, both
she
heavy set women.
something about she has a song about sidewalks. I know who
Mhm.
you're talking about. Some yes.
Her name will come to me in a minute.
Adele.
Anyway,
Adele.
Adele, thank you.
Yes. Hmm.
So both morbidly obese women.
Yes. Hmm.
Well, Lizzo went down the road. At first, she's changed her mind now, and I'm glad she has. And I was open about it on this podcast. I do not believe in fat shaming.
No, of
But
course
when
not.
you have someone that's got the platform that Lizzo has, very talented, very beautiful woman, but she's morbidly obese,
Yes.
do not tell me that she's healthy,
No.
because she's not. So she went down the road of, hey, I'm fat and happy, so screw you guys, right?
Mhm.
And everybody went, woo, great job, girl. You tell them, you go,
Right.
girl. And then Adele
Yeah.
had the audacity to lose weight. To lose weight, she got hate mail. Oh, you're not one of us anymore. The
Right.
woman just wanted to be healthy. But guess what Lizzo did?
I know.
Lizzo changed her mind and went, you know what? I am a beacon. I am someone that people look at. I can't do this.
Right.
She started losing weight and getting healthy. So now I
Hate.
applaud her, right?
Vicious. It's vicious, the repercussions and
Right.
the
But I'm glad that Lizzo, I'm proud of what she's doing now, because she's holding the mirror up to other young
yeah.
women, other talented young women. We can't keep going down this road and telling people, look, during the last election, I don't talk about politics on the show, but I thought it was something very interesting that I saw. And it didn't just come and go, it stayed around. And I think it's still out there. I think it was the left that was saying that exercising and going to the gym is racist and right wing.
It's right-winged, yeah, and
And
it's a privilege.
I was sitting there going, wait a minute. I go to the gym, and my gym is about 50% black,
Mhm.
25% Hispanic, and as I call it, me, right?
Yeah.
So it's me and about 5 other white people. I go to a predominantly black Hispanic gym,
Mhm.
and I'm like, okay, is this gym considered racist? And is this gym considered right wing? I didn't see one MAGA hat in my gym. I didn't
Yeah.
see one. And look, you could tell right wing people, because where I live, they drive pickup trucks and they got a flag in the back, right? You know,
Yeah.
there none of
Yeah.
those people were at my gym.
I live in
So
Florida, so if that tells
how
you.
can I live in a southern state too?
Yeah.
How can you say that somehow working out and trying to be healthy is a racist white right wing thing? And the one gym I go to happens to be, and I'm not kidding, at least 50% African American, at least 25% Hispanic, and me and a Jewish guy. So
And so it goes
yeah,
so it's like so in my TED Talk, the warning from TED, the trigger warning, is because it says it stigmatizes obesity and drug addiction. There's absolutely nothing that I say is stigmatizing. Obesity is not healthy. The process of trying to make yourself healthier should not have any political connotations to it at all. It's ridiculous to say it is. My politics are very personal, whatever. I don't, whatever. And I think people, when they hear fat shaming, if the fat shaming ignores an obvious diagnosis, and there have absolutely been cases where cancers have been missed or things have been missed because, oh, you're just fat, you're just heavy, you're just use drugs. Just because somebody is a 10 pack a day smoker and they come in short of breath doesn't mean that I ignore everything else going on with them. But I have to take it into consideration.
of
I am
course,
not saying you're a bad person. I am not saying you're weak. I am not saying there's anything wrong with whatever culture you come from. Like Filipino culture, they eat rice. Who am I? I mean, it's very hard to get somebody on a low carb depending on their culture.
right.
But it doesn't negate the science. And there are ways of making the science a lot less blunt. I will 100% admit, I'm tough love MD, right? I'm not really good at subtlety. I'm a night shift doc. I'm not good at that. But you can't stigmatize a patient at all. But patients have to be willing to understand that my job, you came to me because something is wrong. My job is to really try to help you figure out what the problem is and figure out how to fix it. If you don't want to hear it because you're offended by it, that's on you. That is not on me. but I'm just doing my job. And so I really, really appreciate the fact that you're pointing out this. I kind of hope my TED Talk goes viral, not because I want to be like an influencer. I want the message to spread. I want the conversation to be open because there are so many physicians who are so afraid. They're afraid of losing their jobs. They're afraid of their patient satisfaction going down. They're afraid of a lot like repercussions from the colleagues or the bosses. I want physicians to understand you're not alone. Clinicians, I should say, because there's a lot of good clinicians. You're not alone. And there is a movement in this country to really take back our healthcare system. Putting back the health into healthcare is how I end the talk because I think we can get there. So, okay, I'll tell you what. Before the documentary in Italy, which I feel like I'm personally vested in this point about making sure, maybe your next documentary should be on this subject. I know the brilliant Dr. Todd Otten. He's brilliant. He is working on a documentary now about something very similar um, because there's a lot of us who really have hope that we can address these root cause of disease.
Yeah, and I think we could get to the bottom of it too. And look, I mean, the number of doctors during the pandemic before I talked to people before the show started. They would say, "Can we talk about the pandemic?" And I said, "Yeah, it's kind of a third rail thing. I don't want to get
Yeah,
into it." It was during the election, and
yeah,
they were turning it into a thing. And I said, "I just don't want to go there. I don't think that people can go listen to Rogan or Corolla or
sure.
whoever they want. I don't need to also add to it." But almost every doctor said to me off the air, and you can go down the list of doctors. It's like, yeah, we should be trying some of this other stuff before
Yep.
we take this drug, right? And we should be trying ivermectin and this and that and the whole thing because the drug is pretty much inert. I don't know anything about ivermectin, right? And it's like, I would love to have you guys say that, but please go on Joe Rogan and go somewhere else
let's
because
let's focus on this box. Yeah.
these doctors were scared to. They were
Yep.
scared to talk out loud about this stuff, right? Some of them wanted to scream it from the mountaintops,
Yep.
and it's amazing that doctors have to, they're not allowed to practice medicine anymore, and we will make that the final word.
Yeah.
Um, Amy, tell people where they can find your TED Talk because I thought it was very
Sure.
interesting.
Thank you so much. It's on YouTube. It's if you put Amy Gutman, Gutman, one T, one N. And you didn't call me Lisa, by the way, one
I thought I
time.
was going
You
to call
told me
you
you were
Lisa
going
at
to,
least 5 times. Yeah.
but you didn't. It's Amy Gutman on TEDx, and it's patients are hurt by kind lies. Um, if you like it, I pass it on. It'd be amazing. And then if you are interested in me, because one of my favorite podcasters from Scotland, he's a metabolic health coach, metabolic health with a BS. His name is Martin Gillespie. He said, you can talk the hind legs off of a donkey, which I think is praise. I'm not, I'm not 100% sure. But if you are interested in me coming to talk to you either virtually or in person, you can go to toughlovemd.expert. I'm on LinkedIn, I'm on X. I love learning and I love evidence based and I love sharing the word. And I will take you up on starring. Let's star in the documentary together. I don't just want to be your your
Hey,
exceptionally fabulous
if I can
co-host.
figure out the angle, then you can start the documentary. I just
Fantastic. Will there be a coffee machine in it for me?
probably, look, it's easy to come up with documentaries. The tough
Yes.
part is dropping
Funding.
the 350 to $400,000 into it and hoping that you see it again. That's a so I guess I
Well,
put my money where my mouth
you've
is.
changed my life, so thank you. But
Yeah.
because you changed my life, you've helped me change other people's lives. So it's not quite as good as the cash necessarily in your pocket, but know that you're helping with a revolution in healthcare, and I am personally and professionally grateful to you.
Yeah, and look, documentaries, people say if your money comes back, that means it was a success.
Hmm.
And I've been very lucky. Have you ever seen my first documentary, Fat, a documentary?
Yes, and then fat
Yeah.
too as well. Yeah.
Yeah. I mean, that's one of the few documentaries where the money came back plus, plus, plus
Good.
in history, right, of documentaries. And
Sure.
that's the money I use to fund the other documentaries. But, it's really hard to, every time you put that money out there, I think, is it going to come back? Hang on.
I think it will.
All right. Well, we'll see. And I'll have an espresso machine front and center in the documentary just for you.
So excited. Thank you so
Amy,
much.
I almost called you Lisa. Amy, don't go away.
I won't.
And because we have to wait till this uploads. Folks, you know what to do. We all go shopping on Amazon. Before you go to Amazon, go to VinnieTortorich.com. Click through the banner. It helps out. It puts coal on the fire, gets my train down the track. I'm able to keep the show free for all of these years. Go check out everything Amy Gutman is doing. She's like tough MD.
Tough love. Look, I'm
Tough
doing
love.
product. I'm doing product placement.
Look at that. She's got the coffee cup and everything. I need to get me one of those.
I will send you one of those.
I will take one of those.
There you
Thank
go.
you.
For your coffee and your fabulous coffee machine.
Yeah, well, I make espresso in that thing. So on behalf of Dr. Amy Gutman, my name is Vinnie Tortorich.